All right, welcome everyone. My name is Jamie Bess, and I am joined here with a team of folks from the Tubman Center for Freedom. And oh, I said that all wrong. I'm sorry. The Tubman Center for Health and Freedom. And they are here to have a conversation about COVID vaccinations. And so I would love to give everyone a chance to introduce themselves. First up, we have Denisha Jefferson Abai.
Hello, thank you. Thanks for having us, Jamie. Um, like Jamie mentioned, my name is Denisha Jefferson Abbey. I'm the COO and founder of the Tubman Center for Health and Freedom, and happy to be here today having just a casual conversation about vaccines as part of our Blaxinate campaign that we started in June of this year. Um, and my background is really twofold. One is I come to this work as an organizer. I've been an organizer for 25 years, over 25 years. And in addition to that, holistic fertility specialist. I did manual therapy specifically to help folks with reproductive issues in partnership with Eastern medicine practitioners and reproductive endocrinologists across the Seattle region. And I started the Tubman Center for Health and Freedom because of the way that the current medical system is set up. It is not set up in a way to serve our people. And with that, we wanted to reimagine what healthcare could be and really design from the ground up healthcare that would work for us rather than force fitting our people into systems that were not designed for us in the first place. And so when we thought about our role during the pandemic, we started with the basics. We were out passing out masks really early on in the pandemic. And by the time June came around, vaccines had already been kind of out and available to folks. And really by June, when we launched Blaxinate, we were trying to have the conversation with our folks who really either were not sure, already decided they weren't going to, and really just have a non-judgmental conversation with folks, provide the science, be available for the politics, talk about it all, lay it on the table in a non-judgmental way. And so I think about my own journey and path, and 20 years ago, I probably would have been in the same boat of refusing the vaccine. And that would have been, because of the medical distress, my experience with healthcare, and the fact that, I had many family members who had died due to the treatment that they'd received from mainstream medicine. And so I think about that, and I think about, why I have started this journey. I went back to school in order to become a primary care provider, in order to get a bunch of the science under my belt so that I could really digest the information on my own. And with that, here I am 25, 27 years later. And I would, I am definitely trying to encourage folks to protect themselves and each other through this vaccine, because I now understand the science. I know the science, and I'm wanting to make it accessible to other folks who might have found themselves in the same place I was probably 20 years ago. So that's kind of my background, what brings me to the conversation. And I will pass it to Francis, who is also with the Tubman Health team.
Thanks, Denisha. And thanks, Jamie, for the invitation.
Oops, you hit mute.
There, sorry about that. Can you guys hear me okay? Start all over. My name is Frances Placide, and I come to the work, excuse me, with Tubman as the Director of Health Services for Tubman Center for Health and Freedom as a physician assistant. I've been a PA for over 27 years now. Much of my work has been in family practice and general medicine, OB, orthopedic. I've been fortunate to work in many different fields, but mostly I would say I come to this work with a passion for ensuring that we all get access to care that's not just quality care, but care that keeps us and gets us well. I think oftentimes in mainstream medicine, we use the words of quality, but we really don't apply what that quality is in reference to. And oftentimes the quality is about the check boxes or the costs that certain entities are addressing, and not really looking at care that is culturally sensitive, care that actually meets the needs, mattering the context or where people are in their journey to health. So I come to the work with that passion. I would tell you that when the vaccines came out, though I'm a primary care provider, I refused it. I refused it for several months. My spouse is also a care provider, and she had to get vaccinated because she was in the hospital. I don't work in the hospital setting. And so she really didn't feel like she had much of a choice other than to get vaccinated because she was in a setting that was high risk. My stance on it was to wait. I didn't trust it. Even as a provider, even becoming familiar with the science, I was nervous about how quickly it was developed. I was nervous about us not having enough trials to say whether or not it was going to be as effective. I was hearing all the news, but myself, I needed to do a lot of research before I got comfortable. But really, the place that I ended up when I finally did decide to get vaccine was more for me, more about the protection for other people. I recognized I could see what was happening around me. I could see people dying around me. And while I was nervous about what the vaccine might mean for me, I paid attention to the science, understood what the mRNA vaccines were all about, how they work. And I decided that if my spouse needed to continue to care for people in the hospital, she needed to be kept well. I also realized, because I am someone who lives with a chronic illness, that if she perchance came home and was infected, that I was at high risk of becoming infected myself. And so to protect myself and to protect my family, I decided to, and even after I got the vaccine, and even after I was giving the vaccines to other people, it took a while for me to swallow the whole pill. But that's how I came to my own decision about getting vaccinated and our family becoming vaccinated. I'll pass the baton now to Marlene.
Hello. Thank you, Jamie, for having us here today. My name is Marlene Haverty, and I am one of the founding board members of Tubman. So that's how I've come to be with you today. I am a primary care physician, naturopath in Portland, Oregon, and I've been practicing for 25 or so years. I have always intended to have a very diverse and open clinic where we treat everybody with the equal amount of dignity and trying to provide the highest quality of care. We're a very busy clinic. We have 4 practitioners altogether now. And when the COVID pandemic first happened, the day that we locked down here in Oregon, I was sick and my partner was sick and several of our relatives were sick. Some of them ended up in the hospital. Some of them ended up on ventilators and in comas. And so from the very start, it was a very scary illness. And of course, at that time, no vaccine had been developed. And so it was sometime later, I guess a year later, little under a year later, the vaccine was developed. And I too, like Francis and Denisha, also, I was skeptical. It was so new and we didn't have a lot of information about it. It felt kind of like, well, we have to trust something, and this is all we have to trust. And so my team and I, we all sat down, because by then we had been seeing patients in person all along. And we made a decision as a group that we needed to protect our patients, since we were seeing lots of people and, by necessity having to get close to them, and having to have a lot of foot traffic to keep the clinic open. So we decided as a group that we would all get vaccinated. In fact, we all went pretty much at the same time. And it was crazy because we got vaccinated in the convention center, it just standing 6 feet apart with thousands of other people waiting in line to get our vaccines. But we all feel like we made the right choice, especially now, this far, afterwards, having more friends, relatives, patients who have been to the hospital, who have been very sick, and seeing how scary that is for people. We felt, that we had made the right decision, that getting vaccinated was certainly better than going through what we were seeing our friends and relatives go through. And so, yeah, that's how we ended up being more, I guess, for the vaccine, for the protection of ourselves and the community, than being scared and skeptical of it.
Thank you all for sharing your background and really talking more about what led you to choosing to be vaccinated. I think that a conversation that's heard often is some people getting COVID and saying, it was sniffles, it was fever, I was down for a day, and I'm back at it, versus people who, like you said, Dr. Marlene, you have family members who were very sick, family members who were on ventilators, and not knowing which one you might be if you were to contract it, and not knowing if someone close to you contracts it, which one they might be. Is there any chance that they're getting any closer and being able to tell why some people get extremely sick and other people don't? Yeah,
I don't think so. I think in general, we can say that older people and people with chronic health conditions are going to get sicker, but I know several people that didn't fall in that category, were healthy, and they ended up in the hospital. So, and then I know people who had chronic illness and didn't. So, I mean, just from my personal experience, I don't know about all of the data out there, but I think in general, people who are older and have chronic illness are at least riskier for them to be more sick. But we also hear of young people, young healthy people all the time that even die from the illness, and it is a surprise.
Mhm, mhm. Yeah, I think that's absolutely correct. And we have to remember we've seen different phases of COVID now. Like I remember when Delta hit the scene, the providers I was talking to who were working in the COVID units were saying, I've never seen so many young, healthy 20-year-olds on ventilators. And so like COVID, 1.0 looks a little different than the COVID that's continuing to circulate. Delta is the primary mutation that's circulating right now in the US. but the longer it circulates, the more mutations that could happen. And, that's when we're starting to really worry. Well, I mean, we're already really worried, but I become even more worried thinking about, Delta and Omicron staying in circulation longer, and, continuing to mutate to the point that perhaps, our current vaccines won't even be able to recognize it. And so I think that is an added concern and reason why the vaccines are so important right now in this stage.
Yeah, and I do think that there's something to be said for immunity. The ways that we measure immunity right now is the mainstream typical ways of measuring. I have a theory that, oftentimes who we see and know as being healthy and not having chronic illnesses doesn't necessarily mean that our immune system is functioning at its optimal place. There are ways of measuring our immune system that our Western medicine does not typically tend to pay attention to. So if we define our strength by the lack of a chronic illness, therefore I'm not going to get sick because I'm really healthy, especially now with the pandemic being around almost 2 years now. People are so stressed. Just our ability to fight the normal cold. I mean, I think we're we're lucky because we're all wearing masks, and so we're not as exposed to our typical kind of cold viruses in ways that we have been in the past. But it's a strain. It's a strain on the system, and illnesses that don't necessarily show themselves yet in blood work is working our bodies all the time. And particularly when we think about our Black and Brown communities that have had to withstand the impacts of racism and all of the other things that we've dealt with for so long, it's really easy for me to see or to consider that we don't know who's going to be ill when you don't have the label of a chronic illness, like how whether or not you're going to be one of those to end up on the ventilator, because I think those are some of the hidden ways in which we are all built up every day to fight just the normal things that we're fighting against. And I do believe that people in our Black and Brown communities are fighting on a daily basis for survival. So I think it puts us a little bit more at risk of becoming ill. We talk about the social determinants of excuse me, of health that puts us at risk. I think there are a lot of things that put us at risk that are blind, that mainstream medicine is blind to. And for that reason alone, I think we are at higher risk of becoming ill, really ill with COVID if we're not vaccinated.
Thank you for that. Well, as we shift gears into thinking about pregnant people, I know that there's been some conversations around whether or not pregnant women should or shouldn't be vaccinated. Is it safe for them to be vaccinated, or effects on their bodies of being vaccinated? And so I would love if you all could jump into what that is looking like right now and what data might be out there, because people have been getting vaccinated for what? Has it been almost a year? How long have we been?
Yeah, longer if you count the clinical trials.
Yeah.
Yeah, certainly right now the data supports getting vaccinated while pregnant. There are actually benefits to getting vaccinated while pregnant for the fetus. Those antibodies are transferring over. And so, there's that added benefit, more so than even through breast milk. Although antibodies are transferred through the breast milk as well, but more of them are transferred while in utero. So there's that added benefit. In addition to that, the risk of having severe illness with COVID while pregnant is extremely high. And, the risk is much, much, much lower with the vaccine. And so that is another reason why I think it was like every medical association in the world is actually recommending vaccines for pregnant people. And Marlene or Francis, feel free to jump in.
Well, I think it's interesting that, you know, according to the data that we have here, that 148,000 approximately, as of a couple days ago, pregnant people have contracted COVID, and then 25,000 hospitalized, and 250 some died. And also, according to the data, about 100,000 pregnant people have been vaccinated, less than how many have contracted COVID. And so, as what Denisha said is absolutely true, that every piece of data that we looked at, and I know that this hasn't been going on for very long, but the mountains of information that are available on this disease and on the vaccine are far greater than anything I have ever seen. It is prolific how much data and information is out there, more than any one of us could ever read or listen to in a 24-hour day, in, you know, a whole year, and every day listening to it. We still couldn't take in all that information. So there really is a lot of information. It's just been over a short period of time. And so we don't have the long-term information about what happens 2, 3, 4, 5 years down the road. Although with most vaccines, they don't have long-term effects like that. And this vaccine isn't that much different than other vaccines that people have taken and have not gotten long-term effects from. So yeah, I think that what we're always doing nowadays is we're looking at the risk and benefit of the vaccine and the risk and benefit of getting COVID. Because there are going to be fewer and fewer people out there that haven't had one or the other. And so the risk of getting vaccinated is so much less than actually getting COVID.
I didn't know if you wanted to answer, Francis.
Yeah, I wasn't going to add too much more to that, except for the last point that Marlene just made, which is the risk of and not the absolute. I think oftentimes we get lost in the like it's never going to happen versus it is going to happen. And it's important, I think, for us to remember that we're talking about the risk of it happening, right? Because people who don't get vaccinated, excuse me, that don't get ill, it's like, yeah, I will never get ill because I'm always healthy. Or if I did get vaccinated and I did get ill, I thought you said that I wouldn't get ill. Well, we're talking about the risk of the severity of the illness, or the risk of hospitalization and the risk of death, and not necessarily an absolute that you won't die. If you do get the vaccine and then get ill, or the absolute that you will die if you do get COVID. So I think it's important to highlight that we're speaking of the risk of the illness, which of course takes into consideration all of the numbers, as Marlene went through the data, the numbers of people that we have to base those decisions on. And yeah, like unlike any other vaccine or really any other illness in our time, we have more data about this. And I hope we never, ever have to try to one up this, but it'll be the most in our history. And hopefully that'll be it. There won't be another one where there will be a most in history, but this definitely is the most ever.
As we think about, you both mentioned, you and Marlene both mentioned that vaccinations don't normally have a long-term effect. There's not something that we suddenly discover about vaccinations that happened many years ago. But that's a huge fear with this particular vaccination, particularly with conversations around mRNA. And, can you speak a little bit more about really what an mRNA vaccine means and why maybe speak to why people are worried about what this means for what their, DNA will do in the future, or, what is the fear? And maybe what should folks actually be more focused on in terms of what an mRNA vaccine really means?
Yeah. Oh, Francis, did you want to jump in?
Yeah, I was just gonna ask who would like to take that. I don't mind starting it.
Go ahead, you can start.
Yeah, I think what I would say before anything else is understanding like how the vaccine works. So if folks understand how the vaccine itself works, then it might help understand or uh, maybe ease minds about what it does to our bodies in the future, right? So when the mRNA vaccine itself, the M is the messenger, excuse me, vaccine itself. Once we're injected with the vaccine, it pretty much stays at the injection site, and the vaccine itself is a messenger is around a capsule, if you will, and there are spikes in that capsule that looks like the COVID spikes that we all see in the pictures that often show up on advertisements. Those spikes are not the same as the COVID spikes itself, but it helps us. It's a protein that helps us to then produce antibodies to fight, because it recognizes it as a foreign body, if you will, in us. That protein wasn't there before. So our immune system mounts an attack on that protein and teaches our body how to fight in case that same thing shows up again. And that same thing, same looking thing, I shouldn't say that same thing, but that same looking thing, when it shows up, will come in the form of COVID. So then if COVID does enter our bodies are aware and says, oh, I've seen a thing looking like this before. I know what to do. And so that's where the antibodies come into play in us being able to fight the immunity. That vaccine breaks down very, very quickly. The shell that's injected into us breaks down very quickly, and our body eliminates it very quickly. And what we use is the antibodies. So the substance itself in the vaccine is no longer in our body. So when we talk about we don't know what it's going to do in the future, it doesn't get into our DNA. It doesn't come anywhere close to our DNA nucleus to change any of our genetic material. So I think that's why the scientists and the experts in the field are so confident that we're not going to see any long-term effects of the vaccine, both on fertility as well as having an impact on our young kids' reproductive system, because it doesn't come anywhere near our organs. It truly just does the job that it's supposed to do, which is to enter our body. The protein looks like those COVID spikes. If COVID does enter the body, we know how to take care of it because we recognize those spikes, but COVID has not been introduced to our bodies unless we actually get infected with COVID. So I hope that helps to understand like how it works, which leads into that other question of like, how do we know that it's not going to impact us 5 years from now? Because 5 years from now, it's not there, and it hasn't done anything to our genetic makeup itself. Danisha, you want to take it from there?
That was great, Francis. That was really good. And I think the only thing I'll add is, I talk about like these vaccines as like wanted posters. So it's a look-alike. It says this shows your body, this is what we're looking for. If you see it, go after it. And you're not getting the actual, in this case, live vaccine unit or attenuated virus or any of that. This mRNA is actually been studied a very long time. Like this is the first time it's hit the market. I know I've heard from a lot of people, oh, this is new. Yes, and not really. It's been studied for a really long time. They've been looking at mRNA vaccines to treat many different conditions and diseases. In addition to that, like coronavirus is COVID is, not that different than other, related diseases that we know we, can get that genetic code down. We were ready to respond because of the work that has already previously been done. So yes, while it is new, it was new to hit the scene and hit the market. It was not new inside labs and to folks who work with DNA and viruses. Yeah, I guess I would only add that. And if folks want more information, there's plenty of good, accessible videos on DNA translation, DNA transcription. You can learn about, how DNA actually works, what mRNA actually does in the body. It's really not scientifically possible for it to cause some of the concerns that we've been hearing around long-term issues. It's just not, the science does not support it. It's not there.
All I would add is that because some people are concerned about the side effects, and the side effects aren't because of that little mRNA particle. It's because of that rush of antibodies that is being produced very quickly and very aggressively. And that's why people have the flu-like symptoms or the swollen lymph nodes. And possibly even that's why we're seeing menstrual irregularities, is because of that rush on of those antibodies that are now circulating where they weren't circulating before. And there's a lot of antibodies that are generated after an actual COVID, especially if it's a severe COVID illness. About 2 weeks later, you're going to generate about 9,000 antibodies per whatever unit they measure that in, but that's a lot. After the Pfizer vaccine, it generates about 1,500, and after Moderna, about 3,000. So we're talking about a lot of antibodies that are coming on very fast. And I think that that's why we're seeing these side effects of people getting fevers and flu-like symptoms and irregular periods, et cetera, is from that rush on of the antibodies, not from that actual small mRNA that's being injected in.
Thank you for that. I know that the menstrual irregularities has been a big kind of, I guess, trending topic.
Mm-hmm.
I am curious if there's been any other, if there's any other data around beyond menstruation around what's happening with pregnant people and their placenta. I think that's been another conversation that has been kind of widespread, that there might be detachment of placenta for pregnant folks. And I don't know if you all have heard that one, but it's been a question and concern.
Yeah, so based on the data that's existing, there's no increased risk of miscarriaging or birth defects from the vaccine. Compared to the normal population, we don't see any difference in the amount or number of miscarriages or birth defects or toxicity of the placenta even. Yeah, so far everything is looking good. I don't see any data that's suggesting otherwise. I think that is, a fear that people have, but so far the science is not supporting that. So far we're looking good.
Yeah, and I think the only thing that I would add to that is people might be like, well, how do you know? I think it's important to understand that, again, because of the proliferation of this disease, we have numbers and we've got monitoring, again, probably the most monitoring that the field has ever done on an illness, because we're all impacted by it. Too bad sometimes the things that impact us doesn't get the same kind of attention nonetheless, we know that because the whole world is impacted by this, we've got a lot of data. So there are 5 ways that both the CDC, FDA, and experts are formally monitoring side effects, monitoring any trends, looking for trends of illnesses or reactions to the vaccines. And again, in ways that we've never done before, but there are 5 ways that that's done formally, ways where people can use an app after they've been injected to report their responses to it. There are a couple of studies and projects, excuse me, where pregnant women or those pregnant people or those who have become pregnant shortly after being vaccinated are reporting into a data bank. And so there are hundreds of reports that are being received on a regular basis. When people say, like, how do we know? It's not just what your neighbor kind of have told you stuff. There are formal ways that the system, if you will, I think is doing right by monitoring and capturing a lot of data and looking for trends of unusual illnesses or unusual responses. If you're getting it from North Carolina and you're getting it from New York and you're getting it from Seattle, then it's something that we've got to look at that's happening, right? If we're getting it from one person, then that's one person's reaction, and you have to take that into context. But we do know the data from which to base the statements of we're not seeing it, right? There's no evidence of it. The data is evolving every day. We know that. We're learning every day as we are seeing variants, not every day, but as the COVID variants pop up, we know things are evolving. So again, it's important to understand that very few things are absolute in this world right now because things are changing so quickly. But from what we're seeing so far, all of the evidence, all of the data that's being captured is not showing that there is any significant side effects to people who are pregnant or pregnant shortly after getting the vaccine that would steer you away from becoming vaccinated during pregnancy. We're just not seeing, it's not being reported out of the over 100,000 people who have been vaccinated. It's not being reported.
That was a really good point, Francis. And I'll say just, it's, I think, important to juxtapose all of that data with the data that we have on what happens when you contract COVID, how that could impact, fertility and carrying a fetus or child. So thinking about, we're hearing reports that after COVID, folks are 6 times more likely to experience erectile dysfunction. We're hearing that embryo quality is decreasing. We're hearing, the same issues around fluctuations in one cycle. And so, I think it's important to account for, we have all of this data showing, that there is no difference between the general population and the population of those getting vaccinated in terms of risk to the pregnancy or risk to the person carrying. And there we have tons of data showing that there is risk to contracting COVID and having that impact one's fertility and embryo quality and all of those things as well. So yeah, I just wanted to.
That's huge. I hadn't heard that. I feel like that's what needs to be said louder for the people in the back. Like, to really put it in a different perspective. Thank you for that.
Yeah, we have some more data on how it affects, the disease affects pregnant people and also men. So I also have a bit of data here that says that COVID reduces sperm count in men and increases ED for 3 to 6 months after disease. And so, you know, that's the other side to look at when you're looking at your risks and benefits of either getting vaccinated or getting the illness. I have not seen yet a consensus on why we're seeing the menstrual irregularities or cycle disruptions. They're probably still collecting that data, as Francis said, because we're only however many months out from, you know, most of the people being vaccinated anyway. But I do have a theory about that. And so the part of the brain that controls the immune system is the same part of the brain that controls the hormones. And so again, we have this onrush of all these antibodies that are coming into the system, and the brain recognizes that and will turn things on or off based on seeing that. Also, the menstrual irregularities I've witnessed in my own patient base have been temporary, 1 or 2 cycles, and then they're back on track again, which would, you know, line up with the theory that the onslaught of the antibodies are kind of resetting the system a little bit, and the brain is working on that. And the feedback system is what actually is getting altered temporarily as those antibodies are brand new to the system. And then the whole system is recognizing them. So anyway, that's my theory. And again, I have not seen long-term menstrual irregularities. It's 1 or 2 cycles and then they're back to normal in most cases.
Yeah.
I would say that your theory is not, you're not alone in that theory, Marlene.
Okay.
I've heard people compare it, experts compare it to, you know, when we are under a significant amount of stress. And, you know, when I practice and in my own life, if I've got a lot of stress going on in myself, my menstrual cycles would not be as they were, you know, a couple of months before. If I've had an illness and I've had to build up immunity to that illness in that time or right shortly thereafter, menstrual cycles impacted. So I don't think you're alone in that theory at all.
Absolutely. Like looking back in my clinical practice with fertility patients, I'm tracking the cycles of hundreds, if not thousands, of women over the course of my career. And anytime someone has an illness or severe stress event, or any significant thing that might occur, certainly a flu or exposure to any other contagion, it can throw off a cycle and frequently does. And so that antibody response would make perfect sense in this case. And, I haven't heard of it having a lasting effect. I do agree. In my clinical practice, it's usually 1 or 2 cycles, typically 1, and then, the person's cycle will bounce right back the following month. If they were regular before, and that would be the case from the stories and the people I've talked to, certainly around this vaccine as well.
Yeah.
Well, I would like to circle back to something that you mentioned earlier, Denisha, about the mRNA vaccines not being brand new and that they're something that has been researched for a while. Can you speak a little bit more about the history of the vaccinations or the vaccine type for mRNA vaccines? I think that that's something that is not really discussed in terms of them being new, but not actually being new.
Yeah. I had this down a few months ago. I don't know if I retained all the information, but certainly, mRNA vaccines were considered in cancer research. They've been looked at in HIV research. And so, they have certainly been something that researchers have looked at, in particular for retroviruses. And so, it's been at least 2 decades old. So 20 years of research on mRNA vaccines. And so, it's I'm sure I find other folks who have been working on them at Fred Hutch who could speak to it much more eloquently. And I used to have this down. Apologize for not being able to pull it out of my back pocket today. But yeah, they've been around for quite a while. That research has been happening even here locally at Fred Hutch, at UW Medicine. It's not brand new.
Yeah, and I think a piece of like the brand newness that sometimes I know I didn't consider is that, again, because we had the numbers, right? The trials, I think, is what people were like, but not enough people have been tested. Well, unlike other vaccines, if we're not in the middle of a pandemic, you have to like wait for folks to sign up for it and get enough numbers, and we had plenty of numbers. And so the trials were not really any shorter. There were emergency authorizations, certainly, excuse me, but the numbers of people that it took to be in a trial to then say that we've got enough numbers to make a recommendation is where it was different for this vaccine versus others, where we didn't have the numbers in others. So therefore it took longer to get there. We had so many numbers with the COVID vaccine that we could, and I say numbers because I don't know what the magic number is for the vaccine trials, but that magic number that they need to have to show that the risk or the benefit of the vaccine outweighs the risk, we were able to reach that quicker than we could with other vaccines, because not as many people were sick with those illnesses to get to the numbers for us to be able to have any confidence in it that it would work. So you couple the years of research with the numbers of folks that were available for the trials, is why we got to where we got to so quickly.
And now, after millions and millions of people have taken the vaccine, we have the most numbers, I think, for sure, for any vaccine, or for maybe anything. And with the like what Francis said, with the development of apps and ways for people to report in on their experience, we have tremendous amount of data now. And every day that goes by, we'll have more, because more and more people are getting vaccinated.
Okay, so we have just a few minutes left. The time has actually flown by. And we did have a question about the child vaccinations, youth COVID vaccines, and what side effects are being seen in children, what concerns are happening for children now that the youth vaccine has rolled out.
You know, there is, aside from one side effect that we've seen more in young adults than we've seen in others, which is the myocarditis or inflammation of the heart. Excuse me, we're not hearing or seeing any other side effects different from what adults are experiencing in terms of the just being vaccinated and the antibodies, the immunity. Excuse me. Myocarditis is the one side effect from the mRNA vaccine in young men, ages 16 to 21, that we have had some incidences of after the vaccine, and typically after the second dose. As far as I know, in all of the research I've done and in the data, all of the reports of myocarditis after proper care recovered, resolved. We'll also tell you that myocarditis is a long-term effect of COVID, and those who get COVID are at much, much, much higher risk of developing myocarditis than vaccinated youth. Nonetheless, I mean, I think it's definitely, it's understandable why people are nervous about it, particularly for the age group that it has impacted. So I think what we can tell you is that all of those who were impacted by myocarditis or inflammation, which again was the body's response. What we don't know is that if that myocarditis was caused by the vaccine, or they think less caused by the vaccine and more as a response, the body's response to the antibody. So it's an inflammation around the heart itself. Still lower numbers than what would ordinarily happen in ordinary life. Nonetheless, of all of those that have occurred, and I believe there were 11 of them, I'll have to look at the data carefully, 16 cases, excuse me, all recovered. After receiving care. A few of them needed to be hospitalized, but no long-term effects, which is different from what we've seen in myocarditis that comes about because of COVID.
And the
16 total?
16 total.
Yeah.
Mm-hmm. And the only thing I would add to that is the rate of that age group contracting myocarditis or getting myocarditis is almost 16. And so seeing myocarditis in the general population is almost at the same rate as this side effect that we're seeing. So we haven't even been able to attribute it to a true side effect of the vaccine, because in the general population, youth that age are contracting carditis at the same rate, or very close to the same rate. Sorry, Francis.
Yeah, I'll make a correction, not 16 total. It's 16 per every 1 million people vaccinated. That's the rate at which it's happening, which is very, 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 I can't say very, very enough. Very, 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 very low. So the risk is really, really, really low. You know, I've got a 15-year-old boy. It's certainly something that I thought about before he was vaccinated. But then when I looked at the numbers, his risk, should he actually get the virus, I decided that the risk of getting myocarditis and from myocarditis was much better than the risk of getting COVID and myocarditis because of COVID.
Dr. Marlene, did you want to add anything?
To the youth question, I haven't had that many of my younger patients under 18 vaccinated fully yet. Those that have had either no side effects or the same that we're seeing in adults, but nothing serious.
And I will throw out there that this is a lesser dose. So the number of antibodies that are being generated are much less than if they were to be receiving a dosage of those 12 and older. So for peds age 11 and younger, 11 to 5, is that right? 11 to 5? Yes.
Yeah.
The dosage is, I believe, a third. Is that correct? A third of the adult dose. And so we will see if the same immune response will happen after the second dose that these young folks receive. It's quite possible, because it's such a lesser dose that they're receiving, that perhaps they won't have as frequent of a immune response that many of the adults were receiving after their second dose. We'll see.
Yeah, we do know that in the trials, they haven't seen any, and the highest numbers that any of the trials have conducted was 44,000 kids between the age of 5 and 11, and they have not seen that myocarditis occur in that age group.
Sorry, I was just talking about immune response.
The immune response in general. Yeah. Okay. Sorry, I was still on the
You're right. You're right. No, that's a good
wanted to make sure to clarify. People who are like, oh, so we're gonna wait to find out if my little 5-year-olds get it. We're not seeing it in the studies thus far.
Thank you. So we have talked, it is 5 o'clock. So I just wanted to give everyone a chance if you have any last thoughts that you'd like to add. I think this conversation could keep going. There's still more questions. And I also would love to know if folks watch this, they have outstanding questions. Can they connect with the Blaxinate Lounge and how best to do that to get questions answered, even if maybe they can't come out in person? Is there a way to connect with you all and keep these questions coming and keep the conversation going?
Absolutely. Folks certainly can come out. We have another one. Our last one of the year is Saturday, the 11th, from 10 to 2. People who want the pediatric dose should register on our website, and anyone else can kind of walk in, whether you want boosters, first dose, second dose, you can kind of walk in. Otherwise, please register on our website, tubmanhealth.org/Blaxinate with an X. And people, we have been reaching out to us via our website and asked for like private one-on-one conversations over Zoom. We're open to it. I hope that it's clear and obvious in our interactions with our Tubman team that we really are open to the conversation. It's not about judgment. It's not about pressure. We do this out of love for the people. And, we encourage folks to be safe and look out for one another. And we think that this vaccine is a good way to do that, but it is all coming from love. So we are open to having the conversation. If people want to have a private consult conversation, reach out to us on our website or come down to the lounge. And we're happy to have the conversation there as well. Francis, Marlene.
Yeah, no, I think that that pretty much says it for me too. Yeah, we're absolutely available should folks have questions for us. Can't ask questions on our Facebook page, right? No, but we are on Facebook. We are on TikTok.
Right here. And Instagram.
And
Yes.
we are on Instagram. So reach out as you need to.
Absolutely.
So I would just wrap up by saying, for anyone who's considering getting vaccinated, not getting vaccinated, to really look at risks and benefits. There's no guarantee either way. Either way, there's risks, and either way, there's benefits. But always, whenever we try to do anything in medicine, we want the benefits to outweigh the risks. And so that's what I would have people look at, either getting COVID or getting the shot. And I'm just going to add that there are other factors that are riskier for our Black and brown populations than getting the vaccine. Yeah.
Okay, well, thank you so much for joining me in this conversation. Thank you for taking the time. Thank you for the work that you're doing in community and just opening up a space to actually have these conversations. And it's been a pleasure. And I know I learned a lot. So thank you, thank you, thank you.
Thank you so much for having us.
Thank you for having us.
Absolutely.
You.
Appreciate it. Everybody stay well.
You too.
Bye-bye.